Well, out of all of the businesses and institutions the global pandemic has shut down, none face the pressure of reopening like schools do. Over the weekend, the CDC released new controversial guidelines in favor of reopening schools this fall. But the biggest question remains unanswered. Is it too soon? To help shed light on this issue, joining us are experts on education and health. We have psychiatrist Dr. Janet Taylor, president of the National Education Association, Lily Eskelsen-Garcia, pediatrician Dr. Sarah Bodie, and epidemiologist Dr. John Brownstein. Our Dr. Jen Ashton is back again tomorrow, just for anyone who was wondering. But everyone, welcome in the meantime. Obviously, there's been a ton of debate over this, a lot of divide among people whether or not schools should reopen in the fall. We know that President Trump urging for schools to open up. Public health experts are pushing back. I want to get everyone's opinion on that. So, Dr. Taylor, I'll begin with you. What do you think should happen with schools this fall?
Well, there's no question our kids need to be educated, but it has to be safe in an environment where they don't have anxiety, where teachers and parents feel safe. And I just think that it's up to individual counties and school boards, unfortunately, because frankly, they have not gotten the guidance and support that they need to assume the risk. But our kids need to be educated, but it has to be safe.
Right. Dr. Bodie, I'm going to get your thoughts on this, too.
Yeah, well, what we know is that this is so critical for kids. These are essential services, and it's not just about their academics. Kids get a host of different support services at school. So that's nutrition, it's mental health, it's their social emotional learning. So the goal definitely has to be to get kids back to in-person schooling, but I completely agree that that has to be done in a safe manner. And I think there are guidelines about ways that we can do that, and it may differ depending on each district. The community viral transmission rate. So this may not look the same at every single school. So we're going to have to work together as local communities to figure out what is the best way to do this in a safe way for each area.
Lily, how about you?
We can absolutely do this safely, but it's not going to be easy. It's very complex. And as your guest just said, you have to take into consideration the science. The science in the CDC guidance, although they wrapped it around how you got to get those kids back in school, when you really look at it, it's very clear. You do it when it's safe. And the most important consideration, that it's the same consideration the Republican National Convention used in canceling the convention plans in Florida. Every plan, and yes, it's going to look very different because every plan has to consider the infection rate in your community. Did the political leaders do what they had to do to get that under control? And so we're going to need a lot of help with things like masks and disinfectants and sanitizing stations, being creative about how you distance kids. I had 39 sixth graders one year in my class. That was not healthy before the pandemic.
Dr. Brownstein, I've seen you nodding your head with a lot of what we've just heard. Is it safe to reopen schools in the fall?
Yeah, I mean, everyone is right here. It's so context dependent. We have very different outbreaks happening across this country. Places like Florida and Texas, you couldn't open schools safely because of the level of community transmission. In certain states where there is low infection rate, yes, you can, but you could do so safely with mask wearing and social distancing where you can keep things under control. But yes, so it's going to be highly dependent on what we're seeing across the community.
Now, Lily, we know that Black, Latino, low-income children are most harmed by school closures. We also know that those are the very communities that have been most hurt by the coronavirus. So what do educators need to be able to do to welcome these communities back to school safely?
Yeah, we think it's a false choice to say, here's an unsafe school, it's unhealthy. Should we keep it closed or should we open it? No, we should do everything that the best health professional advice gives us. And part of it is the distancing, disinfecting, sanitizing, the ventilation, the daily health screenings to detect who might be infected. None of that is going to be easy and none of it is free. But if you do it wrong, you turn that school into a super spreader. Those kids go home, and by the way, in those communities, guess who is more likely to have a caretaker in the home as those kids go home? It's grandma. It's a family member that might be in a high risk group. So we don't want to take any chances. We want to do it safely.
Yeah, and obviously we've been focusing on the physical health of our children and the teachers there in the schools. But Dr. Taylor, this pandemic, as you know, has had a huge impact on our children's mental health. So talk about what the return to school could do to either further hurt or help their mental health.
Yeah, make no mistake, children as young as 5 are very anxious and concerned not only about contracting COVID, but spreading it to their family. So to the same extent that we talk about guidelines and how to keep them safe, we have to continuously express that to our children in a way that they understand and make sure that they see and feel safe. And schools also need to have plans about what they will do if someone has a temperature, is sick, and we tell that to our children as well. Because when you are anxious or traumatized, it is extremely difficult to learn, and certainly we don't want to force our children back into situations where they have more trauma and anxiety, because they are feeling it right now.
Yeah, they certainly are. And so are parents out there. They've sent in some questions about what schooling could mean for their kids. So this first one is for Lily. Let's take a look.
I'm Marcy from Manassas, Virginia, and my question is, what will the protocol be for when a teacher or student tests positive for COVID-19 who's studying in the classroom? Will all of the people be expected to quarantine for 2 weeks and have a negative test? If so, will families and teachers be responsible for the cost of the test?
Lily?
I don't think families and teachers should be responsible for the costs of COVID testing or treatment or isolation. But it's an excellent question, and it's why it's so important that the very first threshold is that your community infection rate is at a level where it's less likely that someone will bring that infection into the schools. And you have to have the daily testing and health screenings. We're not set up to do that. The CDC guidelines watered it down, saying, well, just let the parents do that, and we won't worry about doing it at school. If you're going to do it right, you have to have a plan. You have to have it all set out so that parents, educators, and even the kids know this is the plan, this is what makes sense, here's what you can count on.
Our next question is for Dr. Taylor. Let's take a look.
My name is Sage Blinderman. I live in Livingston, New Jersey, and I have 2 children, ages 15 and 17, who attend Livingston High School. I'm anxious both about their health and safety with returning and with their emotional and educational issues that may develop from further distance learning. So I'm just wondering how to manage my anxiety with all of this and how not to transfer it to my kids.
Dr. Taylor?
Well, you're absolutely right. Our kids transmit and feel the anxiety that we have. So number one is to educate yourself, make sure that everyone in your household has a COVID test, know the plans for your school district, go over them with your children. And one of the best things that kids can do, and we can do as parents, is to make sure that kids have structure, including good sleep, good appetite, mindful eating, and have a plan in terms of as it relates to how they study, how they get their questions answered, and do whatever it takes to minimize the stress, because that interferes with their learning.
Yeah. All right. Our next viewer question is for Dr. Bodie. Let's take a look.
I'm Hillary from Encino, California. My question is, as my 8-year-old stepson returns to school, what should I be teaching him at home about health and safety to best prepare him for the return to school?
Dr. Bodie?
Yeah, great question. I think just like we mentioned in some previous questions here, the importance is to really start this conversation now with your children. They are hearing and listening a lot more than you may even think. So you don't want the first time that they're hearing about COVID or these health and safety practices to be on that first day back to school. So working with them at home on what does it mean to wear a mask? How is that protecting you? How is it protecting others? And then practicing. You may be starting with short amounts of time, trying a couple different kinds to see what's comfortable for them, and then increasing the amount of time that they're utilizing that. Having breaks during the day where they're washing their hands, even if they're not going around to other areas, if they're in your home, if they're touching high touch areas, getting them used to going back and then sanitizing or washing their hands right afterwards. All of these things can help normalize that so that when they're seeing that happening at school too, it's just a part of their regular routine by that point.
Yeah, that makes a lot of sense. We're going to wrap up this conversation by checking in one last time with Dr. Brownstein for your final thoughts.
Yeah, I mean, I think this is a very complicated issue around reopening, and this is where we really need some serious leadership from CDC, especially around testing. There's so much more that we can do to offer our students and our teachers cheap, affordable diagnostics to help, isolate those that are ill, keep kids in school as needed, and really create a safe environment. So we can do this, but a lot more work needs to be done.
Well, I want to thank all of you for joining in on this very important conversation and shedding so much light on what we need to keep our kids safe. We certainly appreciate all of your time and expertise.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.